Thank you guys for being here. Again, I appreciate you taking some of the time out of your day today just to be able to be here and hear this information. I truly believe that you will find different pieces in here that maybe you have never looked at before that can make a huge impact in your life as it has in a lot of our patients' world. So I really hope that you enjoy this, and at the same time it's entertaining too, and not just because I'm in sunglasses on the beach. So anyways, here is a picture of me and my beautiful wife, Dr. Sarah, who is also one of our therapists at the clinic and co-founder of Balance Within Physical Therapy. Um, and so going into this class, wanted to, whoops, excuse me, I have to move this screen here because it is blocking my view. So I apologize for that. Okay, now I can see everything. Who is this class for? I was just saying I'm really excited for you guys to be here with it, but who is it really for? So it's not really just a class for limiting low back pain or sciatica. This is really for someone who's looking to get to the root cause of their problems. So to be able to get out, whether it be hiking in the mountains, be able to attend a recital, sit comfortably, get on and up off the floor with the grandkids, just take a bike ride on a beautiful sunny day, like my friend Mike over here, who is also on the Glacial Drumlin Trail right by where we're at, but play pickleball, get out in the garden, or just be confident that your body will work with you as you age without any nasty surprises popping up that will limit you for what you want to do. But if this does sound like you, whether it's low back pain or pain shoots down the leg for sciatica, whether you've had arthritis, degenerative disc disease, which is really not a disease, herniated discs, spondylolisthesis or stenosis, or you feel you one of those people who've just tried everything, whether it be chiropractic, physical therapy, massage, acupuncture, meds, injection surgery, and are still dealing with this pain. If you want to be more active, but you cannot due to the pain, or even if you're just afraid of making it worse after, or even if you've just been told, which is the worst, you're just going to have to live with the pain. One of my biggest frustrations is when I've heard that, not only on my journey, but when patients come in and see us and they've been told that, is one of my biggest professional pet peeve. But if this looks like you, then you're in the right place. But hopefully you're not in this much discomfort. But this is myself and one of our other therapists, Dr. Mike on the team, our wonderful Dr. Mike. What you're going to learn tonight, what really causes low back pain and why you are most likely looking at it incorrectly, and some of the missing links that can be driving this back pain and driving you crazy. Problems with imaging, problems with a number of the solutions that exist, and a number of ways that you can start addressing this right now. And with the information shared in this class, this is what usually makes me most excited, is that you can apply this to almost every common problem you may be experiencing in your body that you have no idea is connected. A little bit more about us and why we're doing this, why we're on this journey that we are. We opened our practice Balance Within in 2015. It really was to provide a better solution for overcoming low back pain and addressing a lot of the missing pieces to help people get back to their lifestyles. And at the same time, wanting to teach people the tools to help keep them feeling their best. My story, I'm going to get into it more in just a couple slides, but for me, I was really a chronic low back pain sufferer for over 20 years. I had gone to a lot of traditional forms of modern medicine, and it was a long journey, but I want to make sure that people have options that allow them to get off the merry-go-round of going around the system to one clinician to the next, to the next, to the next. We've helped over 1,000 people get access to this highly specialized physical therapy and improving the outcomes of these individuals for over 8 years. And we just have and we're very proud of the reputation of being able to fix problems where other therapies have come up short. Right now, as we continue to grow, our Google listing 85 plus 5-star reviews right now, and voted in the top physical therapist in Lake Country Family Fund for 4 years running, and just being known as leading back pain experts in Lake Country and Milwaukee area.
Wow.
So with us, we really our favorite people to work with, just people beyond 40 plus, looking to maintain that active lifestyle, trying to do it naturally. So staying out of the surgical room, staying off medications so that you can be active and just get back to the lifestyle that you want. A couple quick housekeeping items here. This is being recorded. In the question portion at the end, I will be stopping the recording just to make sure that your information remains confidential with anything you might feel called to ask. But if anything does arise during the presentation, please just feel free to type it into the chat and I will address it right at the end of the presentation. And then just make sure your mic is muted just to minimize any background noises. And if you don't want your face shown on the replay, you could just turn off your camera. And ultimately, the information in here, it is for informational purposes only, just because of the standpoint, it's not to be replaced by a thorough evaluation by a physical therapist. And we've had a number of questions too leading up to the workshop as to how best to work with us, but right at the end, we'll give you the best ways and meet you where you're at with where you're ready to go on this journey. And for all you guys who are here, we're raffling off a free 55-minute session right at the end of this. So stay to the end. You hear what special offers you have, and one of you guys is coming away with a free session from this. Sound good?
Sound good.
All right. Very good.
Wonderful.
Thanks. Just a quick bit about my background as well. I'm a doctor of physical therapy, orthopedic and spinal specialist, and then John Barnes, myofascial release specialist. And for me, also a chronic back pain survivor after over 20 years of living with this. Co-owner and founder of Balance Within Integrative Physical Therapy, and then just ultimately outside of the clinic, father, husband, avid biker, hiker, and musician. This is me playing at a place down in East Troy called Grassway Organics. It's a fantastic place. Pizza on the Farm. So I've played Pizza on the Farm for a number of years. It's a fantastic place if you've never checked it out. First, a few stories, just in terms of seeing some of these case studies, really is impactful. These are the stories that really drive home why we do what we do. So for this one right here, this was a 44-year-old teacher. He had extreme back pain for over 4 months. And I remember when I met him, he couldn't stand for over 5 minutes at a time without even dragging his left leg behind him when he was trying to walk. And then he was someone who was just very active, golfer, softball player, hiker, and musician. He had done 18 traditional PT sessions and over 10 chiropractic sessions, 2 MRIs, and 3 rounds of spinal injections, and had no relief. And at 44 years old, was told a spinal fusion was his next step. So in just a few sessions, sometimes these easy wins that can be there, not everyone's going to always be able to get it 100% in those first few sessions, but the potential is immensely there. So for him, we were able to reset his foundation. His back pain was 90% better. What that is I'll explain that just in a few slides. And we retrained his core. And it's really not entirely what you think. And as of this point right now, 2 years later, he is he's back to all activities, golfing, softball, hiking, all of it, no surgery, pain-free day to day. He was one of our favorites. Another story, this was a 68-year-old retired grandmother with back pain, hip, knee, foot, and neck pain. So for a lot of individuals, whenever they come in, there's always that like, oh, I hurt here, but then the more you get into it, there's the shoulder, there's the foot, there's the ankle, there's the hip, there's almost always something else going on. So this was someone who was watching her grandchildren 2 days a week, and at the time was a 10-month-old and a 3-year-old, and she was having a hard time lifting them up. And one of the things I'll just say, she's like, this baby's heavy. Is like, that baby was the lightest he'll ever be today. So we got to make sure that you are able to continue on that pathway of being able to lift that heavy little one. But for her, the breaking point was a bike ride where she was laid up for 5 days, had 2 rounds, spinal injections with just 1 week of relief, and then the pain returned. So kind of just tried a few other things, acupuncture, massage, pain returned, or just kind of made some temporary relief. But very similar to the previous case, talked about resetting the foundation and the core and address an old ankle injury, which was driving a big part of this as well. But 8 months later, actually I should update this. This is probably more so about 16, 17 months later now, still traveling, lifting, biking, hiking, and all the areas are feeling better, although there was a bone on bone with her knee. So that was feeling much better, but sometimes we can only do so much in terms of just for some of those knee joints, but you can get them feeling so much more effective, or sorry, so much better, just being able to just have everything working much betterly together. Is that even a word? My story. So ski accident at age 14, poor conditions and skill level which is a disastrous combination. I broke my left collarbone and displaced 3 different levels of my spine. So afterwards, I was told by multiple MDs, sprained your back, you have to work through the pain. So I was very active at the time. I was 14 years old. I was a runner. I played basketball. And eventually I was on the crew team for a while. Like I was a very active individual. And so started going on this thing, massage, acupuncture, meds, x-rays, all of this stuff. And ultimately, it was just temporary and small relief on a lot of these routes, but nothing that actually really ever got me over the hump. And then why it's one of my pet peeves, I was also told by multiple providers, you're just going to have to live with the pain. So fast forward a number of years, worried about my ability to do my job as a PT. With the mindset, if this hurts this much now, what would my life be like in just X number of years from now? 5, 10, 15 years? Like, is it going to be something I have to have a change in profession? Like, what am I going to do? Lots of ibuprofen, Costco-sized bottles throughout the years. Hurt to take deep breaths for a number of years as well, which then developed an improper breathing pattern, which you'll learn tonight is a big problem in the body as well. But I was able to unlock the body with myofascial release, allowed me to get out of a lot of this tensioning in my body, and had a rare occurrence, but it was there in the sense where I grew 2 inches in my mid-30s. I went from 6'2" to 6'4". So it was more so just decompressing the spine. There was still more room for that spine to stack better. And so I was able to get an extra 2 inches on that. If I wasn't tall enough, it was a few more. But now at this point, living pain-free day to day, no meds, continue to be a PT and get out and enjoy life, bike, hike, do my musicianship, and just continue to have those 18 years and counting. Not even longer now. I gotta keep updating yet. But I am a lucky one. I am like a fine bottle of wine, a unicorn of sorts, where I can say the older I get, the better I feel in my body. But this isn't necessarily about me in that regards, because the thing is we all have the capacity and the capability to improve where we're at in our body and feel good in it, no matter how long the pain has been there. So what I'm going to be doing in the next number of slides is teaching a lot of these missing links that I use on my journey, but not only just for my journey, but what we do to help resolve a lot of our other tricky patients, back pain, sciatica, and a lot of other problems in the body that can all be connected to that. Low back pain really is a huge problem, at least from the standpoint of just humanity and the healthcare system as well. It is the second most common reason visit for a doctor's visit. 4 out of 5 people will suffer from a debilitating episode of low back pain at some point in their lifetime. And it is more so people aged 45 to 64 that report the highest rates of low back pain. And as of about a year ago, it was $100 billion exceeded yearly on just low back pain treatment in the US alone. And it's a number one reason for us that people do seek us out for our guidance and our care, and a number one practice for just helping these tricky cases. So let's jump into more of the material. That is a picture that looks a lot like my cat, but now she just looks like she's usually sleeping more than that one now. So getting into this material, lovely question to start it off. What kind of core do you want? Who wants washboard abs? Well, I mean, yeah, they could look nice. I mean, I got my beach attire on. I'm not sure what's underneath here, but who wants washboard abs? I mean, those look good. They gotta feel good, right? Or do you want a can of Coke? Who wants a can of Coke abs? It makes it seem like, just thinking what's in Coke. What would that really look like in your abdomen? So here's more so the better question. What kind of core do you need? So you need a core that can really support your body 360 degrees, top and bottom. It is a canister. What happens when that happens? You have the support, you can build all the rest of your body around. That's why, in the sense of just how everything could be from neck to shoulder to knee to ankle stuff, there's a lot of tie-in to how this midsection and how this middle part of your body is impacting the rest of the system. But this picture right here, I read a study once that one of those cans of pop, that to be able to load it in a full can, it can take up to 700 pounds of force. As long as it's equally distributed, it can take up to 700 pounds of force before it even changes shape. It's amazing just what a cylindrical shape in nature can do. And so what does that mean? So It ultimately means that a six-pack ab or washboard abs really does not mean you have a strong core. It may look good, there's strength in there, but it doesn't necessarily mean you have the strength that you need to support the body the way it needs to. If you cannot stabilize with this canister, thank you, of the core, you will overstress your spine, your discs, your nerves, and potentially other aspects of your body, such as I mentioned, like knee, ankle, hip, shoulder, all of that. And how you breathe and align your body greatly impacts your spine and the rest of your body. So you can see right there on the A picture, that is something that's properly balanced, where it is more so equal pressure top and bottom and on the front and back. Now, it doesn't have to equal perfection to feel good in your body, but a lot of times people may come in with an alignment more like B, where you have a little bit more of these tight low back muscles and kind of more of kind of just kind of bringing that chest up a little bit is just an example with what we kind of see with how that core is behaving or not behaving. And when we see that as in B, that is a sign that things are not working well together. There are other things that can show that as well, but that is a classic example. So breathing, how this impacts. You're breathing wrong, and it's likely hurting your spine, your neck, your joints, your digestion, and even increasing your stress. So your diaphragm. Diaphragm is your primary breathing muscle that rests right underneath or right inside that rib cage. It is your primary breathing muscle, but it is also one of your primary core muscles, and that is sometimes something that is not necessarily recognized, or this is something that is missed in previous treatments as well. So if it is not working properly, you will not be able to stabilize your core effectively. You will not be able to stabilize your spine. And then once that happens, it is a domino effect. So the body alignment and posture greatly impacts the diaphragm's ability to work properly, which then impacts the rest of the body as well. So what makes up this core more specifically? So what this canister is, on the top, on this picture on the left side, that diaphragm is your top part of that canister. The middle part is the deepest of all your abdominals. It's called transverse abdominis. It kind of goes all the way around like a girdle or a corset. And then the muscles of the pelvic floor. So those three are, if we could break our core down into its three most primary components, we're looking at those three creating that cylindrical shape. All the other abs, though, like such as the obliques, the rectus, which is your six-pack muscle, they do help. But if they also are overworking because the muscles underneath there are not doing their job, that is going to create tension imbalances, and that will contribute to pain in the rest of the body. But it is truly a balancing act for those muscles to work together, and restoring that is where you can get a lot of long-term impact and long-lasting results in your body. What about glutes? Well, glutes are a very important part of the body as well. It is something that a lot of times people who've come to us who've done previous therapies will say, "Hey, I have my PT elsewhere, and when they had me work on some exercises, I was working on this, and this." I'm like, "Okay, looks like a lot of glute work." They're like, "Yep." Okay, what's going on with the other kind of stuff? Well, or the core, and with that, those two are working together. But if they're not, you're missing out. So it's not so much of this sitting down at the gym, drinking a martini, working those glutes, or just sitting on our behind all day, which we do as humans, which throughout our entire evolutionary process, we sit more now as we ever have throughout our entire evolution.
Yeah.
And I'm sitting right now too. But seriously though, with the glutes being the largest muscle and stabilizing muscle in your body, it is a very important part. But however, if that canister in your body is not working properly, it does have a huge influence on the glutes. At least in the sense of having that canister work for you, it aligns the pelvis better and then allows your glutes to engage that much more effectively, ultimately creating a much greater strength and stability foundation for the whole body with that, which then allows you to achieve much higher levels of strength throughout that system. So being able to be more active without hurting on the other side of it often can come down to, at least muscularly, a lot of these areas as foundational pieces, and then you build up from there. Other pieces that can impact it, there's the fascial system. What is that? That is a connective tissue system of webbing that connects all of us. And so it is kind of like a cobweb. So if you think of like what a cobweb, you can see it almost in that picture on the bottom and on the top too, with the artist rendering of it. It is this connective tissue system that goes throughout our entire body attaches to every cell. And the tricky part about it is these next couple points. One is it can produce up to 2,000 pounds per square inch of pressure at its highest capability. Two, it does not, it is the one graded connector of everything. And then three, it does not show up on traditional imaging, X-rays, MRIs, or CT scans. So in the sense of if you have a tight connective tissue system in your body and you are, even though like the capability of 2,000 pounds per square inch, that is the worst case scenario, but this is a very high force producing system. And so if you are feeling like your body's getting compressed, feeling like there's tightness in there, not only from the stability standpoint that helps it, but addressing this system that can exert up to 2,000 pounds per square inch of pressure in the body at its highest capability can make a huge impact of unlocking those straitjackets and those intense traumas or those intense tightnesses that can come from traumas, such as injuries, accidents, or even small trauma such as how we repetitively sit or maybe how we move a certain way, and we kind of get stuck in those patterns, and it does create different patterns of that body being pulled out of alignment. So everything is connected in the body. This is a couple different artist renderings of that fascial system. And so looking on the left side, you can see some specific systems that have greater connectivity that are all connected from top to bottom. And then even just on the right side, one of the ways we can kind of look at it is that if you have a sweater, now in that picture, that's like a full body sweater, like one of those little nighttime, onesies. But if you get a snag in that system, you get something that has a high force exertion going on in there, and you can see those lines of tension going throughout all other aspects of that body. So it's an incredibly impactful system that can really have a huge impact as to why people will not recover from some of their injuries unless this system is addressed. Other tools, dry needling. There's a lot of people who maybe heard of this or maybe haven't. It is more of a buzzier type of treatment in the past maybe 5-10 years in the physical therapy profession. This is one of the modalities we do use as well. But what it is it just uses tiny little needles, kind of like acupuncture needles, goes into the belly of the muscle to help release a muscle spasm. And this is something that can work very quickly to help unlock some of these muscle responses in this system as well. So it can sometimes help you get some quick relief from aches, pains, stiffness, and especially back pain when this is combined with the other treatment approaches. So oftentimes it is kind of figuring out the right recipe of treatment for what's needed for that individual's body. And so with that, because there's no one size fits all, this is one of those things where this is just one of the dozens of tools in the toolbox that can help. So at the end, you can learn about signing up for a free consult or whether this is something that could be any potential benefit to you, or maybe there can be some other options as well. These are some of the most common questions that we have that come into the clinic. Should I get imaging done? Have I tried everything? Maybe I need meds. Will surgery fix this? Will an injection help? And the biggest question of my philosophical thing is, how do we all know that a new dog food has an improved taste? That is something I still haven't figured out, but maybe Google has a response to it, but I still have not done that. And that's me pondering right there as part of this life perplexity. Imaging. Okay. Should someone get imaging done? This is one of the most common questions that when someone comes in. So it's not necessarily bad to have imaging. It's in right situations, it can be an impact to make sure that you're heading down the right pathway. But here's the thing. So like with MRI, the joke in the profession, or at least in the healthcare profession, can mean MRI stands for might reveal injury. For even just based on research showing that 60 to 70% of adults with no symptoms can have abnormal findings on the imaging, it doesn't always equate then that just because you have pain, you need imaging. So in that regard with it, for example, there's two famous studies done. There's a group of about 100 people, all aged, I think it was like 55 plus. Half of them got MRIs on rotator cuff. Half of them, the other group then got MRIs on their spine. The other group, there's another one that had it on the knee. Over half of them in every single group, rotator cuff tears for the shoulder group. For the low back group, either had disc bulges, spinal stenosis, and sometimes disc herniation. Yeah, but it was mostly disc bulges. And then for the knee, over half of them had meniscus tears. So it doesn't always mean that just because there's something found with it, that it's always going to equate that that's where the pain is actually coming from. And there's also the cost with it as well. Average cost of an X-ray, about $100 to about $1,000. An average cost of an MRI, depends on the situation, anywhere between $400 to $5,700. Medications, injections, and surgeries. Oh my. So to be clear, there is an absolute time and place for all these approaches. So I am very grateful for modern medicine in a lot of ways. There is a right time and place. So as much as I'm saying we're trying to avoid these, and of course we do want to avoid it, there is the right time and place. Especially if you're in excruciating pain, you can't function well or even sleep well. Sometimes we need to bridge that gap. But the average cost, though, too, at least if we're just looking at it as a root cause or a root solution to the cause, if we're looking at even the cost and truly what you're getting from it, each spinal injection is about $4,000. Average cost of a spinal fusion in the Milwaukee area is about 70 grand. And the rate of success for these spinal surgeries is about 50% in terms of taking the symptoms down for what people are looking for. And there's also the truth that there's no such thing as a medication without a side effect. I mean, how many times have we seen a commercial on TV? Everyone's enjoying their best life, and here's the good part of it, and here's what it can potentially do for you or do against you. But oftentimes these approaches are bandages, and it could be a matter of time before the pain returns if someone is looking at this as a root solution. So another way to look at it, if you drive your car and the axles are all out of alignment and crooked, you can put more pressure on a certain wheel or a tire, which may cause a blowout. If you just change the tire, did you get to the root of the problem? So no. So why would we look at fixing our body like the same way of looking at fixing a flat tire? If we're only treating where it hurts, if we're only doing something where it hurts, are we truly getting to the root of the problem? So looking at some of those key pieces, foundations. What are some of the biggest pieces that will impact the body? You've kind of heard me talking about it a little bit up in these previous slides. So in this right here, this poor stick figure guy has a foundation that is out of alignment. And you can see he's got his feet in two different positions. His arms are in two different positions, and he is just looking frazzled and unhappy. And why shouldn't he? He doesn't look like he's doing so hot. Foundation. What is our biggest foundation? The pelvis, and we can also argue hip and lumbar spine, because really as a grouping together, that low back, pelvis, and hip complex is truly where everything goes through our body. It's where all the force distribution goes through it. It's where everything that we do in our body impacts this area of it. It's kind of like the crossroads that everything goes through. So level and stable foundation will allow the rest of the body to work much better together. And even research will back this up where it says that 90% of people with pain anywhere in their body will have an uneven pelvis. So just by leveling it out, you can help the symptoms, but it doesn't necessarily mean that it's just going to stay there. So that's where we need to still look at other pieces. At least for a 1A foundation, your feet. And that's surprising, right? Every time we take a step, it's the first point of contact with our environment. It's with our feet. And so looking at even just the physics equation that goes on with this, if we take about an average of 7,000 to 10,000 steps per day, and even just walking in itself, because we are going from one leg and then bring it through to another leg, we're not always having both feet on the ground. So it can be up to 2.5 times your body weight with each step. And if you're a runner, you're taking 5,000 to 7,000 steps per hour, then with each step going up to 3.5 times your body weight. So whatever that weight is, if you're 150 pounds, multiply that by 2.5, by 3.5, you're looking at hundreds of pounds that body has to absorb. But if your feet are flat or have tissue or structural imbalances, that's going to affect everything else, including looking at the areas that we were talking about, your glutes, your thighs, your hips, like your low back muscles, like all of these areas will be impacted by that. So even if you are balancing out like a pelvis or getting the core to engage, if someone's feet are all messed up and they're taking multiple steps a day, what do you think is going to happen? And there's a chance that you're going to start to undo some of that work as well. And the feet can really affect every part of the body. This right here, this is a an image taken from our 3D scanner that we have in the clinic for our feet. And so for the orthotics that we use, this is the one that helps people, as you can see in that picture on the right side, how it impacts up the chain. This is what helps people just by getting some proper support underneath their feet that can impact the whole chain all the way up, as you can see on that right side. The lovely part about these orthotics that for me, for someone who's had to wear orthotics since age about 6 or 7, is that this is the only orthotic on the market that actually addresses all 3 arches of the foot. They do have the system patented. Growing up, I didn't have 3 arches in my orthotics either, but they still did the job well enough. These are fantastic. 95% of patients love it. They offer full money back guarantee. It fits with the model of you find the pain, but you look elsewhere for the cause. And this could be a big piece of that. Other missing links for the back pain, these are some of the usual suspects. Fascial system, 2,000 pounds per square inch of pressure, pelvic alignment, problems with your breathing and pressure management of that cylinder. Your deep core muscles, which would be in part of that cylinder, but make sure that they're actually coordinating properly. Are they kicking out in the right way rather than just asking all those tight muscles, which are oftentimes the ones that are holding you up more? Instead of asking those tight muscles to kick in first, can we get those deep muscles to kick in first so that everything can work better together? For movement patterns and body mechanics, lack of strength or even mobility in your upper back can drive a lot of that too. We talk about the ankle, there's strength of the hip, or even just poor posturing, where if we sit too much, we can get tight hip flexors, or just looking at all the imbalances of our society that has ultimately led us to more health problems, and especially in our physical bodies. I don't want you to look at this list and think, I have so many things that I need to fix my body. It's more so if you tried things before in the past, but it hasn't gotten you to where you want to be. And since you're here, there's a good chance of that. If you work with someone who hasn't looked at multiple pieces of all of these factors that can go into this, there's still probably a lot of opportunity for someone to be in a much better place in their body. So please don't let this be overstimulating seeing that. It's just more so there's a lot of different opportunities. I would look at it that way. And sometimes when we look at all those problems, what came first? And really doesn't matter. So if you're looking at the foundations of your body, addressing the problems in isolation may help it for a short term, but ultimately you're not getting back to where you want to be because it's a bandage or it's an impartial fix. So addressing the body as a body rather than a random set of isolated problems. Again, the person who's got the back pain along with knee pain and then shoulder pain. So don't just look at it as isolated problems. Looking at it as one whole unit, that can be is the missing piece to just get your life back without worrying about if the pain is going to get its angry face back in here again, like this chicken and the egg. Here's the kicker. This information is just as applicable to jaw pain, headaches, knee pain, hip pain, shoulder pain, pelvic floor dysfunction, almost any other problem in your body. And so, again, this doesn't mean that you just treat the areas where you hurt and only address the foundation. It means that if you only treat where it hurts without addressing the big picture, you're limiting the success and potentially then still living with where you have your limitations of not being able to get out, go hiking, go golfing, confident that your body's gonna be able to travel, or even just do things with people that you love and being around. So for all the pieces to work together, we need all the pieces working together for spinal health with it, because again, we are not a bunch of random places in the body working in isolation of each other. Exercises, everyone got a PDF ahead of time for this. I'm going to do the exercises at the end for anyone who still wants to stick around. I could just talk you through it with it since I'm kind of in one stationary setup right here. I don't know how great it's going to be with the screen in the background, but I'm still just going to talk you through it. So just letting you know, if you want to stick around to the absolute end, I will go through these exercises and talk you through them just a bit more. 5 more just short tips with this. We talked about breathing. Breathe through, in terms of just if there's one impact that you can make in your life, breathing is probably the one area that can impact everything in the body. And this includes beyond the physical pains that we have. This can help with our digestion. This can help with our stress response. This can help with our our immunity because it helps increase our circulation. And all of this ultimately would come down to just these tips. Breathe through your nose and try and breathe a little bit slower, because with that, we're trying to get people to breathe a little bit lower into the body. And it will, when we get into the exercises, in a certain 360 pattern with it. But most people are hanging out breathing with the shoulders, just with the chest, or just to the belly. So all these impactful areas would be decreased just from breathing better. So breathe through your nose, breathe less, move more, get out, walk, hike, bike with it. Because even just as the old adage goes, the rolling stone gathers no moss. If we're getting up and moving, that does help keep our tissue more pliable, more flexible, and ultimately getting out of that vicious cycle. As part of getting out of that vicious cycle, that if you hurt and you stop moving, you hurt more. So keep moving as much as you can. And when you're moving, when you walk like you mean it. And I kind of put in there like John Travolta, Saturday Night Fever. It's more so just the fact that trying to get that rotation with your mid back and your torso and move your arms. Everyone walks so rigid, and just the body wasn't designed to just walk with just a straight up and down. With that in itself, engages the core better, engages the glute better, and allows for better force distribution in the body. It's a small tip, but it can go a very long way. And then again, with the sitting, try to get up every 2 to 3 times an hour, and especially if you have a desk job. 2 more tips. Everyone who stuck around here, you guys are awesome. You got this. And so, in summary, source of your pain is not just where you hurt. There could be dozens of other factors that can contribute to your low back pain. And you just learned a lot of the top reasons. Start to breathe better. Again, that is the #1 impact. If you can get your body to breathe better, it will even just stabilize your spine just from breathing better. Studies will show that your spine will stabilize even just from breathing better. Learning where you need to start is oftentimes the first step. Because looking at the things I had on the list there, we can go to YouTube. We can look at different exercises and videos. But knowing where you need to start is one of the biggest things that can help make that impact on that journey. Knowing where to start and where to go with that. Because it's the tip of the iceberg, we do like at a different number of dozen different things to make sure people are able to fully recover and heal from their back pain. We're here to help you. And just from the standpoint of just doing this and living this right now, this is our passion. We're here for you. So pick our brains, use this as a resource. We are here for you. Ultimately, we just want to be a resource for you and make that impact with it. So coming up in just a moment here, we're going to do the raffle for this. So if you're still here, I can't see you on the screen right now as I'm looking at this. Type "I'm still here" into the chat box. My gal Lynn, our wonderful behind the scenes gal, is going to be the one gathering the names, and she's going to shoot me a message real quick as to who the winner is. So type into the chat box, "I'm still here." Lynn is going to grab your name, and we're going to do the drawing in just a moment. And the different ways that we could potentially help you. There's a free consult offer. What's in it for me? So you could be able to speak with one of our back pain specialists, doctor of physical therapy, to start troubleshooting your symptoms. You can come, we can do it over the phone. You could do it over video, or you can come in person. Because really just wanting to hear your story so that we can get to the bottom of what's really causing your pain and what options that can still be done. Find out what your options are for physical therapy and again, for other treatments. So at least this way you have better clarity as to whether we'd be a good fit to work together. And this is a no pressure consult. Like if it's not a good fit, I'm more than happy to refer you on to someone who is. Because I know what it's like to feel stuck and be scared and not even knowing where to go for a resource and make a good decision. Being able to make a good decision without all the information is a scary place to be. So again, I just want to be a resource for you and help regardless of whether we work together or not. What would be like working with the team at Balance Within? We do all 55-minute one-on-one in a private treatment room with your one-on-one back pain specialist. if anyone's done physical therapy before, sometimes you might be one of 3 or 4 patients going on at the same time. If you've been through that before, I'm sorry. I used to work in that setting as well. It sucks for me, sucks for you. This is all one-on-one with it. So we just want to start out, hear your story, finding out what's most important to you, what your goals are. Take a look at that thorough body evaluation, really looking at what's causing your symptoms, what needs to be done to get you feeling better. And so looking at all those different lists of things we can see, we can look at all these components that we looked here and then start to get a more thorough game plan. And so then from there, get a to-do list as to how to address some of these mechanical issues in the body, start getting you feeling better, getting you meeting your goals, and give you an estimate about how many sessions it could take and how often you need to come in just to make sure that, and for how long we would need to work together. And so there's no box that everyone has to fit into, even though we look at these. So this is specific to your body. What fits your needs is not one size fits all. And so then oftentimes the second half of the session with it is getting the hands-on work, whether it be dry needling or hands-on work for myofascial release, dry needling, or teaching you what you need to do to start getting better and continuing to get the needle moving forward after your sessions. And then future sessions are always geared towards whether it be hands-on therapy, education, exercises, correcting imbalances, or anything else that would be helpful. And then the main goals of working together, we're looking to get to the root of the problem. Get you out of pain, first and foremost. Get you out of pain, address the root causes, and then get you back to more of the activities you need to do or want to do to get back to the ones that you love to do. And then get a solid game plan together just to keep you feeling better long term without worrying about, is this going to pop up again? Is this going to be something where if I'm out on the golf course, if I'm traveling, what's going to happen? Having that confidence can go a very long way of enjoying your life. For anyone who signed up for the masterclass tonight, this is some of the also special offers as well, that this is only for ones who are here for or are here and signed up for this class. So for anyone, you can get scheduled for in the next, I think we're sending it in next week and a half. Anyone who gets it on the books, it doesn't mean you have to come in the next week and a half, but get something on the books for a free consult or for new patient appointment. You can unlock the 2023 Black Friday prices, which is ultimately the deepest savings you will ever be able to get at this time for packages and also for custom orthotics. So since that was the biggest savings of the year in 2023, we brought it back just for this workshop with it. So this is the opportunity that you guys would have to get an opportunity just to have our brains, pick our brains and give us the opportunity to help you with that. And so for whichever option would fit you, if you're ready to just get started, just to get that full body evaluation, get hands-on work, get being able to the root of the cause of knowing where to start, you can just put in the chat, sign me up. Lynn will grab any of the text that you guys put in the box, and then we're going to follow up with you with that. But just to make it streamlined right now, you can just put sign me up for that. If you still have questions, if by seeing this and the information is piquing your interest, but you're like, I'm not so sure, just put free consult. We can do that, and we can do the free consult again over the phone, in person, over video, whatever fits your needs. And so this is, again, a great option to get to the bottom of what's going on and know what your options are. Really, it's no pressure with this. So if we're not a great fit, we're happy to connect you with someone who is. And then for more information, if you just want more information, we got a number of resources that we'd be happy to share for you. So just put more info into the box, and we'll make note of that and connect with you to get you going with that. All right. Let's see. Okay. And thank you. Thank you very much for being here.